I wanted to welcome everyone. Hi, I'm Christy Flynn. Hopefully you're all here to learn about ozone, like home insufflation, how to use it at home and how to do it and how to get the ozone into and onto the body. We also teach IV in ozone. That's, we're using it at a medical practice. We'll teach practitioners and clinicians, doctors, how to, you do a blood draw and you mix it in the bag and then you put the with the ozone, you put it back in the body. But that's not this training. So just to clarify, because there are two separate trainings, there's one for the doctors that are practitioners looking to learn IV. This is the home option. So this one will cover more vaginal insufflation, rectal insufflation, ear insufflation, ozone water, things like that. And I mean, the reality is for the price of a couple of sessions at a clinic, you can have a setup at home and treat your whole family for life pretty much. So, so that's what we'll be covering today. And I have like 3 things that I like to mention that are just sort of like precautions or things to know about if you're going to have ozone in your home. So I'll go over those briefly, and then I'll demonstrate all the different attachments and explain how all that works, how the generator works, where to get your oxygen tank and all of that. And then some of you may not have equipment yet, so I'll go over to the website and kind of show you what you would need if you wanted to get started and how to purchase it, because it can be a bit confusing just because it's very customizable. So I'll show you that. And then, of course, I have a lot of resources and educational information, and I'm happy to send that your way. Please don't take anything I say as medical advice. I am not a medical doctor. I've been in health and nutrition for about 15 years, but I've worked in both sides. I started in pharmaceuticals. I worked for Pfizer, maybe back before I knew better. And then I transitioned into alternative or holistic medicine. And I worked at a clinic in DC for a number of years as their health and nutrition consultant. I think there's a time and a place for both. In acute care, our medical system is fantastic. If my son breaks a leg on a trampoline, I'm really grateful for it. But when it comes to chronic conditions and prevention and things like that, I think that there's a lot that can be done in the alternative healing space. And I'd like to make sure and introduce you to Micah. He's the owner of Simply O3. So you may have seen him on the Doctor's Ozone website or the Simply O3 website. He has a lot of really helpful tutorial videos that are very short. It'll be like a 5 or 6 minute video, and it'll say, how to do rectal insufflation or how to make ozone water. And sometimes if you're sitting down to do it for the first time, it's really helpful to just hit play on one of his short videos and be able to kind of walk you through it step by step as you're doing it as well. So I'll make sure to send you, I'll email you guys a playlist of all of his short, quick little YouTube videos. I also posted them. We started a Facebook group a couple of weeks ago. There's already, I don't know, a couple thousand people in there, I think. And it's called Living Healthy with Ozone. I will happily send an invite to you all. And you're welcome to join us there. But I did post the videos there. We try to go live in there every so often. And there's other practitioners in there. So if you have specific like protocol questions, or you just want some support or help around kind of crowdsourcing information that as you're going through your treatments and therapies for a variety of different health concerns, there's a lot of other patients and practitioners in there that are very generous with their time and chiming in and helping give some guidance and feedback. So that place can be a great place to kind of stay connected to a community of like-minded people that are, maybe going down a similar path as you. A little bit about ozone. Most people know it to be this oxygenating treatment system that really saturates the cells and the space, the blood and the space between the cells with oxygen. So it can be really great for chronic disease or a lot of health ailments, but it can also be great for preventative care because it helps mitigate oxidative stress and a lot of the things that, contribute to the aging process. And so if you haven't tried it before, it sort of feels like this, like an alarm clock. It kind of is great for your energy. I like to do it in the morning or in the afternoon because it does give me a pop of that mental and physical energy. And it's not like a sledgehammer of like a caffeine hit. I could do it before bed and still sleep just fine, but it is quite energizing when done right. And I also find that a lot of patients, it's a great standalone treatment option for a variety of health concerns, but a lot of patients also really like it and use it as an adjunctive tool that can be combined with almost any other intervention, supplement, or therapy because it is very safe and has little to no side effects. So, okay, the 3 things that I mentioned that I want to just make sure you're aware of since you're going to potentially have it in your home. The first is that you want to make it and take it right away. So make it and take it. That's because oxygen is the O2 molecule and ozone is the O3 molecule. And so when you convert your oxygen into ozone, that ozone O3 gas molecule is relatively unstable and it wants to revert back to oxygen pretty quickly. So it only has about a 2-hour half-life. And so that means that you don't want to make it and then leave it in a bag or leave it sitting around for very long because it starts to revert back to oxygen pretty quickly. That's also why you can't buy like bottled ozone water on a store shelf, because after a couple of hours, it would just be oxygen and it would be regular water. It doesn't really have any kind of shelf life. So make it and take it would be the first thing to note. The second is that ozone is a really powerful oxidant. So this is a video of ozone being blown on a rubber glove. And as you can see, it's very destructive and oxidizing to that glove. So our bodies have this antioxidant system present. And when we use, let's say, like rectal insufflation, we put it into the bloodstream. The colon has this immense amount of vascularity, so it gets absorbed into the bloodstream and distributed to the cells, tissues, and organs that need it most. Within milliseconds, it's then converted into oxygen. So because it interacts with those antioxidants. And so it doesn't have a chance to be so destructive inside the body because it's not in ozone form for very long. It's a heartbeat and then it's oxygen. However, our lung tissue does not have those antioxidants present that will convert it fast enough. So it can be irritating to the lungs. So that's why you may have heard or read that it's not safe to breathe it in directly from your generator or even in the atmosphere when there's like an ozone alert day. That's because it can be very irritating to the lungs. It's not, if you do, you'll know because you will, it has a distinctive smell. It's sort of, I don't know, I think it smells kind of like summer rain. But it will, if it gets too strong in the room, just remember ventilation is important. Open a window, turn on a fan, get the air moving. It's not going to stay in ozone form for too long, but you don't want to breathe in too much. And if you do, it's just going to feel like you inhaled something scratchy, like it might make you cough for 10 or 15 minutes. And some people are more sensitive to it than others. So it's just a good idea to remember to kind of keep the room ventilated and try not to breathe it in too much too quickly at one time. There is actually a safe way to breathe it into the lungs, and that's if you convert it to ozonides rather than in breathing it in straight out of the machine. It's really easy to do that, and I'll show you how in just a second. But I just wanted to let you know, try not to breathe it in. But remember, the lung tissue will heal, but you will cough and feel kind of scratchy for 10 or 15 minutes. Okay, and then the third thing is that ozone is really best done in low, consistent doses over time. It's what's known as a hormetic therapy, much like exercise or ice baths, like cold plunge therapy. So you want to expose the body to it consistently over time to stimulate the healing results that you're looking for. Just like if you were going to go to the gym and work your biceps and get strong arms, you wouldn't do 10 hours in one day of bicep curls and expect your arms to feel amazing and for you to walk out having incredible results, right? It takes consistency over time, and ozone is very much like that. So if you do too much too soon, it's not necessarily going to hurt you. You just might not feel great. Ozone is fantastic at killing off all of the viruses and bacteria, parasites, yeast, fungi, things like that. But if we kill off too much too soon, it all dumps into the bloodstream, and then it causes detox symptoms, and what they're called Herxheimer reactions. And those detox symptoms might be like nausea, fatigue, headache, maybe just mild cold and flu-like symptoms. So if you're having any kind of unwanted symptoms or it's not making you feel great after you do it, you might consider backing down your dose or doing it a little less often or reducing your concentration, things like that. Because you really should feel energized and good when you do it. There's actually a really helpful protocol book I'm happy to email to you all as well. And it just has general guidelines and talks about certain concentrations and how often to do it. For instance, it says if you are actively trying to address a health concern, then you would want to do 5 days a week. You give the body ozone, 2 days a week, you take a break from it. So maybe 5 days a week, you do rectal or vaginal ozone or a combination of the two, and 2 days a week, you would take a break from it. And so that's a pretty generally well accepted and well tolerated starting protocol. If you're just looking for maintenance and prevention, then it would be 2 or 3 times a week would be kind of the goal there. So I'll make sure you guys have that protocol book so it can kind of give you some good guidelines for getting started. Also, ozone's really well studied. There's a lot of medical studies. I got these, I won't go over them now, but I just took little screenshots from PubMed, pubmed.org. So if you're someone looking to dive further into the research, I suggest hopping over there on PubMed. It's really well researched for over, several thousand medical studies on over 100 pretty serious conditions. So, let's see, I'm gonna click a little bit through here. Okay, so there's a few other benefits that, I think sometimes we go down a rabbit hole of researching something for our particular health concern, but there's actually a whole host of other ways that we could use this tool in our home medicine cabinet, if you will. So one of my favorite things about ozone is its ability to balance the immune system. It's an immune modulator. So it's great. We all want that strong, robust immune system to fight off whatever is coming at us, right? And we want a healthy white blood cell activity to do that. But if we're someone that struggles with an autoimmune disease, you don't want something that's going to amp up the immune system across the board, because your system is already so revved up, it's attacking its own healthy cells and tissues. So you need something that's going to give you that robust white blood cell activity to fight off the bacteria and viruses and yeast, things like that, without triggering a flare of your symptoms by ramping up the immune system, across the board. So ozone is great in that it is an immune modulator. So it's going to help tamper down those autoimmune reactions while giving you that, extra strength in the immune system that you need to fight things off. So it's great for patients with, anything like type 1 diabetes, celiac, MS, Hashimoto's, things like that. It's also great at increasing your oxygen efficiency. So oxygen efficiency is how well our body can disperse and utilize the oxygen that our lungs take in, right? And so that is something that declines as we age. And our body, even if our lungs take in a certain amount, our body isn't as capable and able to get it to all the organs, tissues, and cells that need it most. So ozone is fantastic at restoring and repairing that process, even between and beyond your treatments. So it's going to allow your body to better utilize oxygen. And while it's on here, it's mentioning respiratory disorders. I just want to show you how to breathe it in safely so that you can use it for any respiratory disorders you may come across. This is an oil bubbler. So you would fill this with like an olive oil, and then the ozone, one of these tubes would attach to your generator and one would attach to like a nasal cannula. And then the ozone gas will blow down into this stem here. I don't know if you can tell, there's like large holes in the bottom of that ball. So the ozone will blow down into the oil, and the oil will trap what would be irritating to the lung tissue. So that way, if you have, then it's safe to breathe it in, because the oil is now trapping, whatever because the lungs don't have those antioxidants. So if that can be, it's not going to be a systemic treatment where it's going to go into the bloodstream and address the root cause of everything else that's going on. But it is great if you're struggling with some kind of infection in the lungs, or maybe there's asthma, emphysema, things like that. So anything that's nasal, throat, and lung, you're going to want to blow the ozone through your oil bubblers so that you can safely get it into the body. And it's called ozonides. When you blow your ozone into your oil, the byproduct that you inhale then is called ozonides. You convert it to ozonides. Okay, and then also I have a lot of patients with, maybe ozone's great at increasing microcirculation and increasing the rate of healing throughout the body. So if you're someone or know someone that is concerned about heart attack or stroke, or is looking to help recover faster from that, I have a lot of patients with heart issues that really benefit and love ozone. It's really also good at reducing the inflammation in the body and in the blood. And then a lot of cancer patients love ozone. I mean, the reality is healthy cells require oxygen to function and thrive, and cancer cells can't live in a high oxygen concentration environment. So ozone can be a great tool to add to a lot of your cancer protocols. And then I mentioned how it mitigates the oxidative stress, which contributes to our aging process. And so a lot of my biohackers and those of us looking to just, increase our health span and feel well as we age, ozone can be a great tool to assist in that and keep our immune system strong, especially going into this time of year, things like that. I love it also because it's so fantastic at helping detoxify the liver. I think in holistic medicine, a lot of times when we want to heal the root cause of an issue, we have to intentionally throw a system or two out of balance so that we can address and correct what's going on at the root cause of an issue. And then in phase 2 of the healing, we go back and bring that system back into balance. And so a lot of times that system that takes the brunt of the damage is the liver, because, it has to detox everything that we are throwing at it, all the killers we're taking, all the die-off, everything that we're throwing at our bodies to try and heal. The liver takes a hit. So ozone is not only great at mitigating that liver damage throughout that process, but in phase 2 of the healing, especially when you're doing rectal insufflation, you're getting it locally right there on the liver to stimulate healing, and then a systemic effect as well. So that's really why I put a lot of emphasis on liver health. Like many of you, I've had cancer, I've had mold, black mold toxicity, I've had Lyme disease, I've struggled a lot, right? And I've had leaky gut. So I feel like putting so much emphasis on the liver and on that liver detox and using ozone along with other therapies to do that is why I feel so much better in my 40s than I did in my 20s and most of my 30s. So I really can't stress enough the importance of keeping the liver healthy and strong as we go through, a variety of different healing crises. Okay, so that's pretty much most of my slides. This is Dave Asprey, Ben Greenfield, Dr. Mercola. They're just guys that, they have great blogs and great websites. They're big fans of ozone and have done a great job of educating people. So if you're looking for more research, I believe Dave Asprey and Ben Greenfield have this exact same setup that I'm going to show you now. So let me get to that. I'm going to stop the slide share so that the screen gets a little bit bigger and you can kind of see what's going on here. Okay, so I'll talk for a second about the oxygen tank because I get a lot of questions about that, and that can kind of sometimes be confusing for people when you're just getting started. So this is a 40 cubic foot tank of oxygen from Airgas. So there are 2 types of tanks. There's a medical tank, and then there's an industrial tank. This is an industrial tank. I demonstrate that one because most people that I speak with are going to be acquiring an industrial tank. The medical tanks just require a prescription to acquire. So that, for some that's easy to come by, for some it's not. Anyone can get an industrial tank. They're sold at welding supply stores all across the country. The 2 most common brand locations would be Airgas or Praxair, Praxair. And this is a 40 cubic foot tank. There's also a 20 cubic foot that's a little smaller that might also be an option and be easy for you. And then the only thing to know if you're getting it from a welding supply store is that their license does not cover them if they are selling to people who are using it for medical internal purposes in this country. So they could get in trouble if they know that you're using it medically or internally. Because the type of oxygen that gets piped into those tanks is virtually identical. It's just a licensing issue. So they want you to be using it for industrial purposes. So what I say, if they happen to ask what you need it for, is I say I have a home oxygen water treatment system for my laundry. A home oxygen water treatment system for my laundry. Because that's not untrue. I could use this to make ozone water and then use that to disinfect my laundry. I have a friend who does that for her cloth diapers. I also have a pool or a spa, so I could use it for something on that. I have a friend who's an artist and she uses oxygen to blow art on canvas and make her art. And so that would be another example of an industrial use, right? So a home oxygen water treatment system for my laundry felt most true to me. So that's once when I went for a refill and they happened to ask, that's what I said. And that was fine. And that way I'm not getting anybody in trouble for selling it to me. So, and then this is the regulator that attaches to your oxygen tank. So there's 2 types of regulators, but only because there's 2 types of tanks. Both of the regulators function the exact same way. A regulator will control your concentration of ozone that's coming out of your machine. So this regulator is this is the industrial regulator. So if you know you're getting an industrial tank, you're going to want to make sure you get the 540 industrial regulator, only because the tops of the tanks are styled slightly differently. And so the regulators are made differently because they attach in a unique way to each different tank. And then there's a little dial here on the end, and you just turn that to whatever number, let's say you're looking it up in the protocol book, you would turn that to that number, and then that would dictate the concentration of ozone that comes out of your machine. This is your generator. So the oxygen goes in to the side here, and then there's a port on the front. You can see that. And that's where the ozone will come out. And then it's just a matter of using whatever attachments you want based on how you want to get the ozone into and onto your body that you would attach to this port here to be able to use your ozone. And there's also a chart on the top of your generator. So let's say you're going to do rectal insufflation for the first time. You would look it up in that protocol book, and it recommends about 40 gamma. And so you're going to look on your chart, and over here is the gamma. And you can see I have a 39 at a level 7 on my regulator, or a 45 and an 8 on my regulator. So just to be conservative, I'm going to round down to that 39 and set my regulator at 7. Just when you're first starting out, it's always best to be conservative and start at lower doses, just so you can kind of see how your body's going to respond to it, how it's going to make you feel. And so I would start at a level 7 and then grab my rectal insufflation bag. Just like this, right here. And so this is the rectal insufflation bag. It has these divider lines here. And so all that means is if I pinch it here, it's going to fill this top chamber. And if I pinch it here, it'll fill the top 2 chambers. Rarely, if ever, have I seen someone do an entire bag. That would just be a lot of gas in the colon all at once. And it might not be very comfortable. So there's no need to do that. When you're just starting out, I recommend pinching it here and just filling up this top 200 milliliter portion of the bag. And it's easy to do that. There's a little lure lock on the top here on the bag, and it just twists onto that port on the front, and it stays on really easily onto that port. And then once you get the bag filled, you just close the clamp. Then you need a rectal insertion tube, which looks like this, right? This is the part that gets inserted. It twists onto that little lure lock just the same. And then there's a little marker here to show you where to hold it. It only goes in about 2 to 3 inches, and the camera makes it look really scary if you don't already have one of these. It's about the size of a coffee store stick. I could probably fit 4 or 5 of these across my pinky. It's very small. You can lubricate it or not, coconut oil, whatever you'd like. And then once you get it inserted, and you can take it anywhere, sit, stand, lie down. The position doesn't matter. It's not like like when you do like a coffee enema where the side you lay on is important. With this, it doesn't matter. You just gently kind of roll the bag, and that will push the gas into the colon. And then that's it, you're done. Then you just untwist this, and then this is what needs to be disinfected. And they actually give you a couple of these little syringes that make that really easy. So what I like to do is I go to my bathroom sink and pull up the sink stopper, squirt a little hydrogen peroxide in there, draw it up, and then this will twist onto that, and you can plunge it through, and it will disinfect your insertion tube. Also, they give you a whole pack of those insertion tubes. There's a pack of about 10 of them. So, I don't know. I have 3 kiddos that I love, but I don't even like to share a toothbrush. So I for sure don't want to share a rectal insertion tube. So if you have other members of your household or friends and family, things like that, that also want to be able to do rectal insufflation and use your equipment, you don't have to share that tube if you don't want to. I just keep a little Ziploc bag with their names on it, and then it's easy and it doesn't get mixed up. So that's rectal insufflation. It's really fast. It takes 2 to 3 minutes. Kind of once you get the hang of it, you know what to hook where and what to put your settings at. It's really, really fast. It's by far the fastest treatment. It's like 2 to 3 minutes total. You don't have to clean the valves beforehand. You don't have to lay there and try to hold it in or retain it for any amount of time. I usually maybe 30 seconds at most, because remember, it gets circulated throughout the bloodstream and then converted into oxygen within a heartbeat. And it's utilized by the body so quickly because of those antioxidants. So you don't really need to lay there and hold it in for any length of time. It's such a small amount of gas. It's usually really easily absorbed by the body. Most people, I'd say at least about half, tell me that it just kind of stimulates a healthy, normal bowel movement about 10 or 15 minutes after administering it. So that is rectal insufflation. So if you guys have any questions, feel free to just type it into the chat. I will go over those after I demonstrate the rest of these attachments. And then this is vaginal insufflation. This one looks a little bit more complicated, but it's really not. It's just there's more tubing and there's a safety device. In my opinion, the biggest difference is that you have to stay near your machine. Whereas when you do rectal, it's faster and you can carry it anywhere around the house to wherever you're comfortable. With vaginal, you stay near your machine because it runs continuously. So the protocol book, for instance, recommends you start at about 20 gamma for like 4 or 5 minutes, but you may work up to where you're doing 10 or 15 minutes. So that's why it can be a little bit of a longer therapy. But it is my favorite. And so it's very simple. It has a long tube that just has that lure lock and it attaches to the port on the front. This is the insert. Actually, there's a new insert. I have the older model. My new one is being shipped, but we have a new insert. It functions exactly the same. It works the same. It's just a little bit more comfortable. If you're used to like plastic tampons, it's about this size, shape, feel of that, of like a plastic tampon applicator. And so this gets inserted. There are 2 prongs on the bottom. So the center prong is where the ozone comes from the machine and goes into the device. And then this prong on the side goes to this destruct. So the destruct is there as just as a safety precaution. You don't have to do anything with it. You just leave it sitting off to the side during your treatment. But it's there because you're letting it run continuously. You run the risk of allowing too much ozone to fill the room. And since it can irritate the lungs and some people are very sensitive to it, the destruct, this little cylinder here, will just convert any excess ozone into oxygen immediately. So it takes any excess from the side here and converts it into ozone or oxygen immediately. The destruct is not like moisture. So before it hits the destruct, it runs through this moisture trap. So it just excess ozone goes from the insert to the moisture trap to the destruct. And so you just leave it off to the side. You don't have to do anything with it. And then when you're done, you're just going to pop these off, and then the insert is what gets washed. And you can also lubricate it if you'd like. You can sit, stand, lie down. You can use coconut oil. You can, however you're comfortable, just make sure you're not pinching the tubes. So that's vaginal insufflation. It's very easy. I really love it. It's great if you have, women just need a lot of healing in that region, whether it's after childbirth and you want to stimulate healing, or sexual trauma. If there's, any kind of UTI, cysts, bladder issues, candida, it's fantastic for candida or yeast infections, things like that. So even if it's just too many days in a wet swimsuit or hot yoga pants, like it's just a really nice option. And it is a systemic treatment. There aren't as many medical studies on it as there are on rectal insufflation, probably because only half the population can do it. But it is, the studies that we do show that it is going into the bloodstream and being administered systemically just as effectively as like rectal insufflation, and almost as effectively as IV ozone, where you put it directly into the blood. So, okay, so that's vaginal. This is ear insufflation. So ear insufflation, this is my kids' favorite. They love it because, what 6-year-old doesn't love a stethoscope? So there's 2 ways to do this one. The ozone just comes out these holes here on the end of the stethoscope. So you can do dry ear insufflation, which is where you just connect it straight to the machine, to the generator. Or the better way to do it would be to run it through a water bubbler first. So to do that, it's actually very simple. The water bubbler looks a lot like the oil bubbler. It's right here. You would just fill this with water. And then one of these tubes would attach to your generator and one will attach to your stethoscope. And then the ozone gets blown into the stem and bubbles into the water. And the stem just has like smaller holes, so it's hard to see on camera. But what that does, the reason why that would be a better way to do ear insufflation is, well, 2 reasons. One is that when you do the ozone gas straight into the ear canal, it can be a bit drying on the ear canal. And 2, when you hydrate the gas and attach a water molecule to it in the ears, it has a greater likelihood of adhering to the inner lining of that ear canal. And then some of it has a chance of transitioning or transferring into the bloodstream. So I like knowing that if I'm doing it anyway, there's at least a chance that some of it is going to also enter the bloodstream and address whatever else might be going on. We typically don't consider ear insufflation to be a systemic treatment because not enough of it enters the bloodstream. However, it's fantastic if you have anything going on in the sinus cavities. Looks like if me or the kids, anybody has any kind of congestion or sinus pressure, maybe tinnitus or any kind of infection or something going on in the ears. So anything in the sinuses or in the ears, using the ozone through the ear insufflation can really, really be helpful. So just remember, if it's nasal, throat, and lungs, you would want to breathe it in through the oil bubbler. If it's sinuses and ears, you can use the stethoscope. So you can also use that same water bubbler to make ozone water. Ozone water can be great if you have stomach issues. I will say the studies are pretty mixed on that it's not as effective of a systemic, bloodstream treatment as rectal, vaginal, and IV, but some of it does enter the bloodstream. It's mostly great if you have like ulcers or a leaky gut, H. pylori, SIBO, things like that. In those cases, I would be doing both. I would do the ozone water and rectal insufflation. So you're kind of hitting the system from both ends. But if you want to make ozone water, usually people do it first thing in the morning because you have to drink it on an empty stomach. And it's a little bit more time consuming. You bubble it for about 20 minutes to get it concentrated. The protocol book will walk you through it. And then you drink it on an empty stomach. And then you still want to wait another 30 minutes to an hour before you eat or drink anything else, just to allow the ozone to fully absorb. And then if you're taking high doses of vitamin C or like antioxidants, you kind of want to wait a couple of hours on either side of your ozone treatment because ozone is a powerful oxidant. So you don't want to take a bunch of antioxidants at the same time because you could negate both the oxidant and the antioxidants. They could kind of cancel each other out. Now, if you're just eating an orange or you're having your normal vitamins or it's, small amounts, it's fine. It's not likely to interact so severely that it's going to negate the effects of your ozone. But some patients are on high dose vitamin C or, IV therapy for vitamin C. And so it's just not something you want to take at the same time if that's the case. But ozone water can be great. You can also swish it around in the mouth and use it for healing things. I like to use ozone oil in the mouth actually because it's great for oil pulling. Like it'll help whiten teeth and reverse, heal cavities, things like that. I don't make the oil at home. Technically you could use your oil bubbler to make it, but I don't really recommend that. You have to bubble it for so long, like about 24 hours to get it concentrated enough to be ozone oil. So you're going to blow through a ton of your oxygen, which is pretty cost prohibitive. Your oxygen should last a good 6 months or more. And then you just go and swap it out for refills. It's like 40 or 50 bucks for a refill. But if you're blowing it, making ozone oil and blowing it for 24 hours, you're obviously going to go through it a lot more often, more frequently. So it's cost prohibitive. It's also, there's a combustion risk because the oil gets kind of warm and hot when you bubble it for that long. And now you have oxygen being introduced into a hot oil. And then the byproduct that is created anytime you ozonate oil and the oil gets heated, it naturally creates formaldehyde, which is not something that's great to be putting onto the body. So I do love the oil, but I don't like to make it with my equipment at home. I use Simply O3 has some, and usually just a couple drops as a dose. I mean, I had a mole that was kind of flaking and turning up here and I put it on there and it went away. Like I said, I'll use it. It's good for collagen regeneration. My daughter uses it for acne, my teenager. So there's a lot of different ways that I use it. But usually it's not very expensive and a couple drops is a dose. So I love oil. I love the ozone oil, but yes, I get that question a lot and it's not something I like to make at home. So, okay. Oh, one more that I want to show you in terms of the attachments. They make a limb bag. So a limb bag is just like a bag that goes over an arm or a leg, and then the bag will inflate with ozone and surround the skin with the ozone gas. And so it's great for topical reasons. It's not going to go into the bloodstream, but if you have anything on the skin, like a rash or an infection, a wound that maybe isn't healing, or a surgical wound that you want to keep from getting infected and want to increase the rate of healing on, you could use the limb bag for that. You could also use the ozone oil for that. I tend to tell people to use both because you can do the bag treatment a couple times a day, and then you can do the oil between your treatments. The oil is like a little bit more diluted form, if you will. And Simply O3's oil, they keep it cool during the ozonation process. So it's good for 3 years at room temperature. It's extended its shelf life immensely. Usually it would only last a couple of months. And because it's cool, it stays cool during the process. It doesn't create formaldehyde. So it would be fine to put on wounds and things like that. And then some places of the body are hard to put a bag around, like the torso or maybe the back of the head. So they make a cup. And this is an ozone cup. You may have heard of cupping, like that suction cups. That's like the detox thing. This is not that, right? So this is just like a cup, and it will fill. It's got a filter in it, and it'll fill the cup with ozone gas, so you can hold it onto a spot on the body somewhere that might be hard to put a bag on. So for topical use, and it just has another one of those little Lura locks that connects straight to the port. So they do come in different diameters, things like that, but this is the standard one. So that's the bagging and cupping. Let me see. I think I covered all the attachments. Let me go check the slides really quickly just to make sure I didn't miss something, because that happens sometimes. Let's see. We covered all that. We went through systemic versus local. The different times, this slide is kind of good because it does show the different times. But, you know, basically rectal insufflation is the fastest, and the others just take a little longer because you're doing the treatment or the therapy a bit longer, but all of them are pretty fast. Okay, really, before I go to the questions, because some of you may have to hop off, I do want to say, I just want to show you the kits because, like I said, basically all you need is the regulator and the generator. Everything else is just whatever attachments you want, depending on how you want to get the ozone into and onto your body. So, for instance, so they're in kits just to make it a little bit easier, but it's all customizable. So the gold kit, for instance, is the regulator and the generator, and then everything you need to do rectal insufflation, ear insufflation, ozone water, ozone oil, breathing ozonides, and the supplies for bagging and cupping. It does not include vaginal insufflation kit. That's about $100, and you could add that on if you wanted that option. So none of the kits include vaginal, probably because half the population can't do it. So any of the kits, you're welcome to add it on. It's about $100. And then the complete kit has everything you need to do rectal insufflation, ear insufflation, and ozone water. And then the home user kit is just for those households that just want to do rectal insufflation. Right now, typically I offer like a 5% discount code, but right now, from now through Cyber Monday, everything on Simply O3's website is 35% off. So if you don't have a kit yet, or you want a vaginal insufflation kit, you can grab that for 35% off. If you already have your equipment, but you want to try the oils or the soft gels, they make little pills that you can take to help with the gut. There's suppositories, things like that. You're welcome. They're all 35% off right now. So it's the only time of year I've ever seen that kind of sale, and we don't usually do more than 5 or 10% ever. So it's a really good time. You got really lucky. Okay, let me go. I'll show you guys. Well, here, I'll show you the website because I know some people may have to hop off. Just so you're aware, this is the website. You can see the Black Friday site-wide sale up at the top there. You get free shipping if it's over $12.50. If you go to products and then click on kits, that's where those kits are located. And you can see the complete kit, the gold kit, and the home kit is right there. And then if you're looking for the vaginal insufflation kit, the fastest way to find that is just to type in vaginal, and it'll drop down. If I can spell, I'll reach across my computer. There, right there, that first one. It'll default to the $110 one that says starter kit. So you definitely want to make sure you get that one because the other one won't have the destruct and all the parts that you need to get started. So just make sure you get the first one. And then the oils and stuff, everything's under products. It's pretty easy. The ozone oils and capsules, things like that are right there. So, okay, I'm gonna stop the share, and then I'm gonna go over your questions in the chat box. And then if you guys, you're also welcome to unmute and chime in if you have any other concerns or questions. Can you make your own oil with the ozone? I feel like I answered that one. So you can, you're capable. I'm just not willing. So that's the answer there. You have a few questions. What is the max amount of ozone cc's recommended daily? So it's really unique because it depends on what your body is used to. Because some people, right out of the gate, some people will go to a doctor and do a 10 pass, which is 10 times more ozone than you do even in a single pass, and about the same amount you would do in rectal insufflation over the span of an entire 5-day period or a week. So it really varies, and most people don't feel great if they do a 10 pass and they do that high dose right away because it kills off too much too fast, and then you end up with those detox reactions. I would say typically people start out once a day with about 200 mils at about 40 gamma with rectal insufflation. And then from there, you can go maybe to 400 mils after a week or two, and you feel good and that's well tolerated. And then you can, I have patients do as much as twice a day. They'll do rectal and or vaginal in the morning and in the evening, twice a day is typical. And then I have some patients that combine IV ozone at a clinic in their doctor's office with rectal insufflation and or vaginal at home. And that might mean, if you do that, I just would say that on the day that you go to get your IV, don't do any additional ozone at home that day. So if you're doing 5 days a week on, 2 days a week off, then you would do, one of your 5 days would be IV ozone and the other 4 would be your rectal or vaginal ozone. And then some people do, of the 5 days a week they're going to do ozone, they'll do 2 or 3 rectal, and 2 or 3 of those days would be vaginal, and they'll kind of rotate the protocols as well. Does the company provide all the protocols for free? Yes, I'll email you all the protocols, the protocol book, this training. There's no obligation. Micah just is really passionate about ozone. It's a personal mission for him. So a lot of his training, he does as much for free as he possibly can, because he wants you to have, to be empowered, to be able to use these tools. And it takes a bit of education. It's a fabulous tool in your medicine cabinet and your home, to empower your home health. But it takes a little bit of education, and there's a learning curve to it. So that's why we started the Facebook group, and we do these calls, and he does the free IV training as well for the doctors to learn. He really does. We try to give you as much resources as possible that you could need to be able to feel empowered and use your equipment. What determines the prices between $1,000 and a $5,000 machine? As long as you're using a generator that takes oxygen, and it's good materials made with regulated industry safe materials, and it requires an oxygen tank and not an air concentrator. Some machines out there will use air concentrators, and the problem with that is the air is not pure. So you could concentrate impurities into your ozone. So if you're using it internally or for therapeutic purposes, you want to make sure that you're getting pure ozone. So I would say that's a big difference that you'll see among the generators, is just to make sure that you're using one. If you're using it internally, that make sure it requires an oxygen tank, so you can know you're getting pure ozone and you're using pure oxygen. Another generator that is a little bit more expensive than this model, this is the home model. This is called the Stratus 3.0. We have a Cumulus that we use in the clinics. The Cumulus just has more bells and whistles, but the home user wouldn't need that. It has more titration options, because doctors, when you're putting it into an IV, or if you're injecting it into a muscle or a space within the body, you really need to be able to get a very, very precise dose to do that. And so that is a little bit more technical piece of equipment. So therefore, it's a little bit more expensive. But the average home user, I don't even show them here, because it's overkill. You don't need it for the home use options. You're getting the education and training so that you know how to use it. And also, there's a lifetime warranty on all of Simply O3's generators. So if anything ever happens to it, they replace it or repair it for you for free. And there's a 6-month full refund. So if you use it for several months and you don't love it, or it's not for you, you can send it back. You have 6 months to try it and send it back. You don't have to have a reason. So Melinda, is your opinion, not medical advice, thank you for clarifying, vaginal insufflation help with uterine polyps? Yes. If it were me or my family, yes, I would be doing vaginal insufflation to help with that. Good question. And also, you're welcome to, in that Facebook group that I mentioned, Living Healthy with Ozone, I'll send you the link. But that's a great place. Like, you can even use the little search bar over there, because so many people have already chimed in with different questions on various health topics. And a lot of our practitioners and clinicians that use ozone, or even just very knowledgeable home users, they will chime in with what they found that works. And so that can be a great place to get support. And if nobody's mentioned it or asked about it, you're welcome to post and ask us yourself and see if someone, has some insight for you there. When you drink the ozone water in the morning, can you add electrolytes and essential aminos? I suppose you could. I wouldn't. I would just leave it straight ozone and let the ozone do its thing. Personally, I wouldn't want to risk interacting with anything, because the truth is, I don't know. You could ask the Facebook group. Micah would probably know. He's very knowledgeable about ozone because he's so passionate about it. But personally, I would just do the water straight so that I know that it's working and I'm not taking anything that's going to interact with it. But I don't really know how ozone would interact with electrolytes and amino acids. So, do we sell medical grade oxygen? No, only because we have tanks. Simply O3 will sell like empty tanks on their website, but it's illegal to ship full tanks of oxygen. So even if you bought an empty tank, you would have to then still take it to like Airgas or whatever and wait while they fill your tank. So most people, it's a lot cheaper to just rent a tank from them. The first time you get it, it's maybe 140, 150 bucks, I think. It probably varies by location. And then when you swap it out for refills, it's like 40 bucks, 50 bucks, something like that. So it's more cost effective to just use their tanks, but you can, my mom bought one because she wanted it to look pretty. She didn't love this like green monster sitting on her counter. So she bought one. And then when she took it to Airgas, she asked them if they would refill her tank rather than swapping it out and giving her an ugly one. And ugly, that's beauty is in the eye of the beholder. But they said that's fine. And they just let her wait while they filled her tank. What is ideal gamma level for daily use to maintain health? I think if you're doing like rectal insufflation 5 days, you don't even need to do it 5 days a week. You could do it 2 or 3 times a week at about 40 gamma. You'd be fine. And I should note also that, your numbers on your machine might look slightly differently than mine. That's because each machine is individually calibrated. So if you watch a video or you compare it to what you see here today, and your numbers on your chart vary slightly, like maybe a 39 gamma is not a level 7 on your regulator, maybe it's an 8 or a 6. That's okay, it's supposed to be. It's because your machine is individually calibrated. So you just want to first pay attention to the gamma, and then decide what gamma you want. And then you go to the number on your regulator and set your regulator. But I think, for me, I do 40 gamma. Well, now I'm at about 45 because my 7 is a 39 and my 8 is a 45. So I do 45 gamma of about 200 mils in my rectal insufflation bag. And I try to do that a couple times a week. And then I try to, or I'll do vaginal insufflation. It just depends on time for me because, I love vaginal insufflation. It's my favorite. And so if you're a female and have that option, I highly recommend it, but it takes more time. I don't always have time to do it. So sometimes I don't have 10 minutes. Sometimes I only have 2. And when you're, busy single mom with 3 kids, that's a big difference. That's a thing. 2 versus 10. What is the worst reaction that happens if you make a mistake with the dose? So if you're doing home insufflation and you're doing like rectal or vaginal, you're just not going to feel good. So if you mess up and you dose too high, you just might kill off too much too fast, and then you're not going to feel great. If I've had women who were doing consistently really high doses every single day and not taking a break, and they were saying like, oh, it messed up. My cycle changed in my periods, something like that. But then when I asked what dose are you doing, it was like 3 or 4 times the recommended gamma and every single day for months. So it takes a lot to see unwanted side effects. So if you try your best to follow the protocols and gradually increase over time, you're going to be just fine. The protocols are very conservative, but some people detox at different rates, and some people have MTHFR and they don't detox as easily or as quickly. So if you're starting out at the recommended protocols and you're not feeling great, it's making you feel tired or making you feel like cold or flu-like symptoms, then back down your dose. You might be too sensitive. Mold in the house. Can I deal with it right now? I have mold in my house, Melinda. I'm sorry to hear that. It's very stressful. Mold in the bodies. So you can use, I used a home ozone machine that was like an air concentrator for my house. And I don't remember where I bought it. It was like 10 years ago. It was before I even knew about Simply O3. And, but I couldn't be in the home when I did it. And then I used ozone in the body to treat inside the body until I got the house remediated. And then I eventually moved out and to the desert. So anyway, that would be good. I would just start doing, you can do ear insufflation if it's bothering your sinuses, like it did mine. I was always congested. And then rectal or vaginal insufflation 5 days a week to start clearing it out of your body. But you got to get it out of the home, right? Because you're just going to keep reinfecting the body if you don't remove the source and clear the home. Jeffrey Mays has a lot of good books on Amazon that was really helpful. And then I worked with a mold specialist, a microbiome and gut and mold specialist, Dr. Daryl Joffrey, Gioffre, Dr. Daryl Joffrey. You can find him on like Instagram or something, but he was really, really helpful in helping me figure out mold and getting over it. Is there financing? They do have financing on their website. If you click, there's like a make payments option on the website. Ozone for throat, tonsils, and mouth. Does the nasal protocol help for this? Yeah, I would do that. But you can also swish it around and gargle it, the ozone water, and that would help too. And then, of course, rectal insufflation is getting into everything, right? So you're getting it systemically to the bloodstream. It's even crossing the blood-brain barrier and helping to heal the brain. So rectal, vaginal, IV, anytime you're doing systemic treatment, you're going to address everything. So that's helpful. Anything that's getting a blood supply too. Should you clench when doing rectal insufflation or relax? I like to clench. I clench, but only for like 30 seconds. You know, I'm like rolling the bag and clench, and then we get really up close and personal here. It's not really difficult. You don't have to. It's going to go in. It's going to go up and get absorbed immediately. So you don't have to, but I do. I don't know why. If relaxed, you think the ozone is escaping. It's not. And even if it comes out, it's used and absorbed immediately as soon as it comes into contact with the mucosal lining of the colon. There's so much vascularity there. It's like putting it into a vein. So Any contraindications? Not with rectal insufflation typically. Usually that's fine unless there's like huge hemorrhoids and there's a block. You know, sometimes I've had people trying to put it into colostomy bags, things like that. The only time you have like contraindications is when you're doing IV, because we use heparin. And so you have like, you know, if somebody who has contraindications to heparin, so if you're on blood thinners, things like that, then you have to be mindful of IV ozone. But with rectal and vaginal insufflation, no, you're fine. It's very, very safe. It's just oxygenating the body, right? I know I owe you an email with a ton of great stuff. So I'm going to send you the links to Micah's YouTube how-to videos that are shorter than trying to go back and rewatch all of this webinar. And then I'll send you that protocol book. I have another ebook that I think is really good if you're like getting started. I'll attach that one. And then the Facebook group, gotta make sure you have that, the invite there. I'll send you a link to the IV ozone in case I always sometimes have doctors who hopped onto this one and also want to learn the IV. So I'll make sure you have a link to the IV training for those of you that it's not going to teach you how to do an IV. So if you don't know how to put in an IV in the body, that's not going to be good use of your time. But if you already know how to do IVs, then that one's also a really good training that Micah teaches. Okay, so I will send all of that your way. I hope to see you guys over on Facebook. If you ever want to join into that group, we're always over there trying to answer questions. And right now we've been traveling to a lot of conferences, so I haven't been live in there as much as usual, but I like to, and I like to connect with you guys there. And I try to offer these, so if you're welcome to attend anytime, or if you have a loved one that wants to learn something. Thanks everyone, it was great meeting you guys, and thanks for sharing your energy today and engaging and asking great questions, and hope you enjoy the rest of your week. Bye everyone.